This is a special edition of Your Marketplace. Are you prepared?
I mean, these surfaces end up being touched by so many people every day. So, they're heavily contaminated.
A day in the life of the pandemic.
Do you want to think about high-energy foods, granola bars, canned meats, canned vegetables? If you're prepared, then you take down the fear and you're ready and you can anticipate.
The dirty truth.
I didn't clean a tester once.
What you need to know to stay safe on Your Marketplace. We're here on the streets asking you what you're worried about. What's your biggest worry?
Getting infected. Yeah. Like for no particular fault of my own.
Touching your face. Because I first thought it was coughing on others.
I think that at some point we're going to have to start looking at more social isolation.
I just want to protect myself.
How to do that? David's on it.
Okay, we're in a pandemic, but most people are going about their daily lives, going to work, doing all of that. What do we need to know to stay safe? You kind of need an infection control and disease specialist, and we've got one. Dr. Susy Hota is with the University Health Network here in Toronto. We'll take a walk here, Dr. Hota, just trying to understand, you know all of this. What are you doing different in your life now?
Well, I think the most important thing to me is making sure I'm cleaning my hands all the time.
How many times a day are you cleaning your hands?
That's a really good question. I feel like it's many, many times a day. I'd say 50 times a day.
Really?
Depends on what I'm doing.
A day, yeah. And what about handshakes? Are those out for you now?
I've been actually stepping away from handshakes for a while now.
Door handles, doorknobs, all of that, what are you doing?
Yeah, so those kinds of items are really heavily contaminated. Everyone's touching them. My way of approaching that is just cleaning my hands after I touch them.
How do you get to work?
I take public transit every day.
All right. Should we go inside, down into the subway, and you can talk about precautions?
Absolutely, let's do that.
First up for Dr. Hota, touch nothing. Not the handrails, not walls.
Now, if you need to, because you're gonna fall, obviously absolutely use it, but then just make sure you wash your hands after.
Immediately after, yeah, okay. What about gripping these kind of things, holding on to the handles? Do we need to be worried about that kind of thing?
Yes, these surfaces end up being touched by so many people every day. So, they're heavily contaminated. I would assume that, As much as the public transit system probably tries to clean them, disinfect them, you can't keep up with the volumes of people. So if you have to hold onto a surface like that, make sure you clean your hands, before you touch your face or you end up preparing food or, doing anything like that at home.
I see actually someone over your shoulder who's wearing a surgical mask right now. Is that something that more of us should be doing?
Absolutely not. We don't really have any evidence to show that just wearing a mask in public spaces is going to protect you from anything.
Really? May
in
not
fact,
do anything.
It can actually do harm. You can be touching your face a lot more often than you normally would.
What about when you're around people? If we're on a train like this or we're on a bus and people are sneezing, people are coughing. Is that something to be worried about?
I would try to keep my distance from somebody who looks like they're visibly ill and they're coughing or sneezing. You do your best. Sometimes it's going to be quite crowded and it's going to be impossible to do that. But I would try to keep myself away from people who are sick.
What's the kind of distance you want from people?
In general, it's about 2 meters that the droplets that contain the virus that people expel when they cough or sneeze can travel. So 2 meters.
But 2 meters, that's
2 meters.
doing
Quite
more
a
than
distance.
this.
That's right. Yeah.
Yeah.
So not always practical.
The latest advice from public health: avoid crowds when you can. Consider taking public transit or going shopping during off-peak hours.
And what about keeping our own homes and workplaces virus-free? What if we run out of wipes? What alternatives are there?
Well, apparently you can make it yourself, but I haven't looked into it yet. That's what a friend told me.
I'm not too sure. I'm not no scientist. I guess, washing your hands, disinfecting surfaces.
I'm not a big fan of the wipes and hand sanitizers. I think washing your hands is the most effective thing.
Yeah. What do you think kills coronavirus?
I'm not sure, to be honest.
So what works and what doesn't? Dr. Hota, I look online and there's so many things that say they kill the virus, but we don't necessarily know. What about bleach?
So bleach is definitely effective. The thing to keep in mind with bleach is you have to dilute it out somewhat because it can be quite corrosive on surfaces, including things like metal. But it is effective as long as you have it on the surface for a set amount of time and it has a chance to actually do what it needs to do.
Lots of demand for these things now. Wipes, they're good?
Yeah, most wipes will work. Most of the ones that you can find commercially, and the nice thing about them is that they're disposable, so you can wipe the surface, toss it, and not have to worry about it.
Isopropyl alcohol?
Isopropyl alcohol will work. It has to be at the right concentration. You need 70% of the alcohol in there, and that is effective to get rid of the virus.
What about hydrogen peroxide?
Same with hydrogen peroxide. That you have to use at the 3% concentration that it comes, so not dilute it. And if you soak it on a surface, it's actually effective against the virus.
Okay, so lots of things that do work, but then I see these things on social media like make your own hand sanitizer or make your own cleaner, and they say things like vodka.
Right, so most types of vodka that you will find, actually pretty much everything, even the 80 proof, will not have the high enough concentration of alcohol in it to actually be effective, so not one I would recommend.
What about vinegar? That's another thing I keep hearing on social media.
Yeah, the acetic acid in vinegar is probably not enough to actually be effective in eliminating the virus.
What are you using at home to clean your surfaces right now?
You know, even just soap and water, if you have that and you're mechanically removing the dirt and the microbes from your surface by cleaning more frequently, it can be effective in terms of keeping things clean and safe.
But I guess you don't want to necessarily use the same cloth to keep doing it over and over.
That's absolutely right. So disposable products or just changing your cloths out frequently is a good way to go to actually make sure that you're not using a contaminated item to actually clean the surface you're trying to get clean.
What do you do if you run out at home? You don't have soap, you don't have isopropyl alcohol. What's a good solution?
I think a good solution is really just using mechanical water and mechanics of washing your hands to clean your hands. And you can use the same for removing items like dirt off the surfaces. I'm very, very careful about washing my hands in that kind of setting.
You're not panicking. You don't seem like you're panicking, but you think these are sensible measures.
Exactly. There's no reason to panic. These are things that all of us can do to try and keep ourselves safe. And the other important thing we can do is think about the people around us. You know, what about the people in our communities who might need a little extra help during a time like this? How do we keep them safe by trying not to introduce infection to them? I think, we have to take this as something we all work on together.
Finally, how sick do you need to be before going to the hospital? Okay, so this is your workplace, a hospital. If people do get the sniffles, if they do have symptoms, should they be coming here?
So 80% of people will have really mild symptoms with COVID-19. And in that case, you don't need to come to the hospital emergency department. The emergency department is here for people who have serious illnesses that need to be dealt with right away. So my advice would be if you're just really mildly sick, call your primary care provider, your family doctor, for example.
So unless it's a big emergency and you really are really worried, don't come to the hospital wherever you live.
That's right.
A lot of us are already following Dr. Hota's advice.
I just be careful of what I touch and try to bring a lot of sanitizer everywhere I go. Every time I get off the bus, I'll wash my hands or use sanitizer.
Smart precautions, but there's also plenty of worry.
We're already running out of hand sanitizer and everything.
I went to the store the other day, there weren't any disinfecting wipes, none whatsoever.
I think it's
pretty scary to think.
We're not prepared for these kinds of scenarios.
Many of us aren't. Check out these pics from stores across the country. No sanitizer, no toilet paper. We're all trying to stock up, but are we getting the right stuff? Before you hit the stores, you need to hear these tips.
We're going to be shopping with Dr. Samir Sinha, an emergency preparedness expert who volunteers with the American Red Cross. Hello, Dr. Sinha.
How are you?
I'm well, how are you?
Very good, thank you.
So everybody's rushing out there getting toilet paper and hand sanitizer, but what should we be grabbing if we have to stay home for 2 weeks?
Non-perishable goods are where you want to start at. You've got beets, you've got cabbage, then you want to think about things that are high energy foods, granola bars, canned meats, canned vegetables. Beans are really good. They're high in protein, and they're very filling. Rice, those sorts of things that can last a long time, even up to a year, because you may never know when you're going to be stuck at home. Well, you know, I mean, one of the things I always say is, like, if you're quarantined, you know, you should have a little bit of enjoyment. Right. So if you have your favorite snacky foods, sure, get those too, but you just don't want to be living on that alone. Could you be stuck without a water supply? So do you actually have, you know, some jugs of water ready to go? And thinking about, you know, at least the 3-day supply is what we recommend in case there's an absolute emergency where things are down and you are stuck at home. If you're stuck at home and you're sick, you know, do you have enough toilet paper? But with COVID, you might want to think about lots of Kleenex because it's a respiratory condition. And finally, make sure that your prescriptions are up to date. Because if you're stuck at home tomorrow, did you actually refill those prescriptions or are you going to run out?
What about cleaning supplies?
Yeah, so I mean, again, you want cleaning supplies that are good against things like COVID and other things. And so basically anything that's a good disinfectant or a cleaner. So those are the things you want. Bleaches, you want soaps. Those sorts of things actually are really, really good. You just want to make sure you clean surfaces thoroughly and you clean surfaces often, especially when we're thinking about door handles and other things where many hands will touch those things.
How much should we be getting?
Well, the key thing is, right, think about how much you eat. Think about how many people are in your household. Is it you? Is it an entire family? Is there a pet involved? And then what would you need to last and eat for 2 weeks or so? And that's what you should be thinking about. And then put that aside.
What if somebody in your household has COVID-19 and you haven't tested positive for it? How do you protect yourself?
So this is where we might say, if you're living in multiple stories, or if you have another family member, you might live in a different part of the house. You might make sure that you're cleaning surfaces, that you're not touching, you know, each other's faces, and spreading those droplets that actually occur. So that's where we'd recommend that people try and separate, because there may be a chance that person stays not infected, and that's better for their health, and it's better for peace of mind for the person who is infected.
If it's too late and I'm self-quarantined and I don't have the supplies to get me through 2 weeks, what should I do?
We always say, you know, in disaster preparedness, have a buddy, right? It's no good if you have family members or your best friends living across the country. They can't really do much for you. But if you have a buddy, for example, they can pick things up for you as well, and they can drop them off. What you want to do is make sure that if they're dropping something off, maybe they can drop it outside your door so that you're not actually coming into close human contact with each other. That way you can actually make sure that things are delivered to you, but you're also not putting that other person at risk. One nice thing is we have apps where you can get things ordered. A lot of these delivery services, they're worried that people are going to stop using them, and these are folks that are often, if they don't work, they don't get paid. So they're people who want to do this work, but we need to be respectful of each other.
So if you're stuck at home sick, keep your courier safe. To avoid contact, ask them to drop off your takeout at the door.